Alrighty, welcome everybody to Pre-Health Shadowing. We are a virtual platform for students to connect with like-minded students as well as established healthcare professionals to gain insight into various health fields during the COVID-19 pandemic. Pre-health shadowing was created in response to COVID-19, as many of the sessions were getting annulled for in-person experiences. This allows students to connect from all over the world. So go ahead and drop in the chat where you're zooming from. Welcome everybody, it's so great to have you. Just some housekeeping things before we begin. We do send out weekly emails with all of our speakers as well as quick links to sign up for their sessions. So if you guys want to never miss a session and make sure that you guys are actually getting your virtual shadowing hours like you would like, be sure to sign up for emails. So you can do this by going to our website, prehealthshadowing.com/join-us, and sign up, put your email in. Once you do that, you're going to want to go into your email and spotlight search pre-health shadowing. Mark our emails as important, and if you save pre-health shadowing as a contact, that means it'll automatically go into your inbox and skip the spam, skip the junk, skip the promotions folder. So if you guys are looking to get exclusive opportunities and information, be sure to sign up for our emails. And we don't spam, don't worry. We're just here for your best interest. We're all students, we get it. An update, pre-health shadowing is striving to create flexible and accessible opportunities for students. So we do have closed captioning for all of our live sessions to accommodate students with hearing disabilities. We also do have an ASL translator on board. And so if you do have a hearing disability and you would find it helpful to have an ASL translator, feel free to email us and we can get that set up. Just an announcement. We do have a COVID-19 fundraiser that we are hosting with Pre-Health Shadowing. So we have partnered with Mask for Mask, which is a woman-led organization that donates masks to communities in need. So this could be hospitals in need, homeless people, and just other communities that are severely lacking in resources. For every 4 masks purchased, 4 masks will get donated. And so we are working to help out whoever we can. We all are students. And so if you guys are looking to get involved, but do not have the financial means to purchase 4 masks, we ask that you spread the word. And so we do have a code, which is PHS15, and that'll give you 15% off your purchase. And so everyone's gonna need masks. We are living through a global pandemic at the moment. This is a necessity. And so please help out if you can. Please send this link to your friends, your family, your professors. Please help us out and help out everybody who does not have the opportunity to get a mask. If you are interested in getting published, Pre-Health Shadowing is taking submissions for various publications. You can submit an article regarding your journey, COVID-19, how it's impacted you, any tips about studying for tests or getting ready for the next semester as we approach it online. You can submit reflections from a virtual shadowing session. So you can submit one for our virtual shadowing session today if you're interested. You can submit reviews either about a shadowing session or our program as a whole, as well as success stories. And so if you're interested in getting published, this is only accessible through the URL, which means you will have to type in the URL to gain access. This is an exclusive opportunity only open to those who are joining us for the live sessions. You're going to go to www.prehealthshadowing.com/blog-submissions. Please be sure to remember that you can't get through this through the menu. So now is your time to write this URL down if you are interested in this opportunity. I'll leave it up for a couple seconds. Take a picture, write it down, make sure you get it. It's gonna go away in a second. Alrighty, I invite you all to pull out your phone and please scan this code. This is going to bring you to our donation page. Pre-Health Shadowing is a student-led nonprofit organization. We are surviving solely off of the help from our community. You guys are all students, we're all students. We understand that we might not all be financially able. That's totally okay. What we do is please send this to 5 other people. If you are not able to donate today, maybe $1, $5, please send this to someone who you think might be able to donate to benefit your education. We're trying to keep pre-health shadowing alive and keep it free for all students. Our website has been crashing quite often, and unfortunately, there's nothing we can do about it until we get a couple $1,000s per month to upgrade our website to allow for the large influx of students that we recently received. Thank you, guys. All right, if you are a high schooler and interested in joining the pre-health shadowing team, listen up. We do have opportunities for you to gain a leadership position within pre-health shadowing. You can be a student club ambassador, which will give you connections to reach out to various high schoolers around the U.S. and establish pre-health shadowing as a club at their institution. If you are interested in learning more about this, feel free to email us at info@prehealthshadowing.com. All right. On the polling, there was a question about getting a mentor. If you are interested in gaining a mentor virtually that you can have for the rest of your career, listen up. We have an opportunity for you. We are hosting a networking weekend, which will take place the weekend of February 19 to 21. When you sign on, this will be an hour long per day. You'll have the opportunity to meet with 2 established professionals per day. You are able to come for all 3 days if you are interested, for a total of 6 professional connections. Not only can you connect with these professionals, you can also meet with like-minded students who have similar interests and aspirations. So if you're interested, this is via invite only. This is how to gain your invitation to this event. Boom, we have a bingo board that is currently circulating on social media. You can download the materials from our Google Drive, register as a volunteer on our website, post this bingo board on your social media. If you don't have social media, you can also email it to friends, family. Once the board is all filled up, or you have $136 in donations or equivalent, you can submit the bingo board and reserve your spot for the mentorship networking event. It is that easy. So if you guys are interested in meeting mentors and like-minded students, be sure to get this in. This fundraiser will only be open until January 31st. So the end of January is your deadline. Be sure to get it in early if you really want to secure your spot, though. If you are interested in helping out during this COVID-19 pandemic, we do have virtual opportunities for you all to volunteer. This is a student-based, student-led program, which means you have the opportunity to submit proposals and actually lead your own projects within pre-health shadowing. So you can start your own initiative, build your own thing within this. This is really a wonderful opportunity. If you're interested, check out our website for more information. If you're joining us for our live session today, make sure to tag us on social media for the opportunity to get reposted on the official page. Go ahead and show up your setup for today. How are you taking notes? How are you joining us today for pre-health shadowing? We're really interested. Go ahead and let us know on Instagram. With pre-health shadowing, students can take a post-shadowing assessment to receive a certificate verifying their hours today. So I encourage you to take good notes and ask our professional some wonderful questions. This is your chance. Feel free to drop questions and comments in the chat throughout the session. Members of our student team will be recording them and asking them during the Q&A portion. Alrighty, and without further ado, I would like to welcome to you our professional for today. Welcome, thank you so much for joining us.
Thank you so much for having me. Hello, everyone. I'm going to share my screen now. All right. Can everyone see that okay?
Yep, looks awesome. Thank
Okay, great. So a lot of my presentation is going to be a lot of pictures because that's the easiest way for me to explain kind of exactly what I do. Let me just get a few things set up really fast. Here we go. So again, thank you, Pre-Health Shadowing Group, for having me. This is such a great opportunity for all of the students out there. I think that this is such a unique way to get health professionals and get you guys connected with us during COVID-19. So great job, you guys. And I am Dr. Sydney Pokard, but you can call me Dr. Sydney. And I do small animal, exotics, wildlife, and zoo medicine. So I'm going to definitely go in depth about what all of that means. These are my contacts here on the front page. So if you want to screenshot that or write them down, you can find me at Dr. Sydney_DVM on Instagram. You can look at my website and also my email. So let's get started. All right. So a little bit more about me is that I live in Southern California, so born and raised in Orange County, California, and knew I pretty much wanted to stay in this area, even when I went to vet school and afterwards. Again, I do a pretty wide range of species. So traditional veterinarians, a lot of them do in this area will do just small animal medicine, but I do exotics. The hospital I work for also is a wildlife rehab center for Orange County. So I see a lot of wildlife. Right now, I'm currently taking care of a baby mountain lion, a bobcat, a lot of hawks and owls. And so we get those are the majority of species that we get in. And then I also am part of the vet team for a local zoo, the Orange County Zoo, which I'll share a little bit more about my experience there. I went to Cal Poly Pomona for undergrad. I really wanted to go there for their pre-vet program because I wanted to get that hands-on experience, but you by no means have to go into a pre-vet program just to become a vet. You can be pretty much at any school with pretty much any major. And then I went to Western University of Health Sciences, or WesternU, for veterinary school. That was my top choice, and I was very, very happy with my decision there. And again, I'll go into that a little bit more. And then that's a picture of me with actually one of my patients. That's an opossum, but that is a client-owned opossum. You do need a permit to own them. And then those are my pets down there, my dog and cat. So let's go to the basics first, especially for the high schoolers out there that may not know exactly where they want to go into, but what is veterinary medicine? So you are a doctor for animals. In veterinary school, you learn basically most every species, or you at least learn categories. So in addition to small animals, which is dogs and cats, you also learn exotic animals, which can be things like hamsters, rabbits, birds, reptiles, things like that. And so in vet school, although they don't give you a ton of exotic experience, you really have to go out and find it. You do have some anatomy and physiology lessons in exotic animals. And then there's also large animal, and that would be cows, any kind of livestock, essentially. So cows, sheep, goats, that kind of thing. And so you are learning the whole range of species. Typically, vet school is about 4 years. So the reason I say on average is because depends on where you go. On the next slide, I'll let you know a little bit more about schools specifically, but as a vet, I can diagnose, treat, perform surgery on all species. I can, and I do on a daily basis, educate pet owners about their animal's health, as well as behavior, nutrition, things like that. And then as a veterinarian, you can also go into specialties just like you can with medical school or human medical school. So you can do an internship and residency. Basically, what that means is after your 4 years of veterinary school, you would go into a 1 year internship and then a 3 to 4 year residency, depending on what type of residency you would want. And that would occur after vet school. So you could be up to maybe a total of 10 years of veterinary training altogether. And there are a lot of there's a huge range of what you can do in veterinary medicine. So you don't just have to work at a vet hospital in a vet clinic. You can work at an animal shelter, you can work at a farm or a ranch, you can work at an animal processing facility. So the USDA facilities that are used to process essentially the food that we eat, they need vets there as well. You can work at a zoo or an aquarium or anything similar to that, like a sanctuary or rescue. Also in a lab, in a laboratory. So a lot of medical schools have lab animal medicine, basically, where we know that they will do certain testing on those animals, and there's a vet that is overshadowing all of that. And then you can also work in the pharmaceutical industry. So to help make the drugs that we use for pets, so whether it's prevention, like flea, tick control, that kind of thing, or also in the nutrition industry. So a lot of the big pet food brands also need a team of veterinarians that work with them. And so admission to veterinary school. So again, average of 4 years. It really depends, because there's some schools, like if you were to go out of the country, they have a little bit of different requirements. Most schools will also require you to have a bachelor's degree when you go to undergrad. So it's not every single school, but that is definitely the trend. So you definitely want to get a bachelor's. But the good news is that you can really have a major in anything. I chose to do a pre-vet major. It was an animal science pre-vet focus, because I wanted that experience with like the farm animals, and having the curriculum was already built in for me to be able to just apply to vet school and have all of those prerequisites. But you certainly can still do it if you have a major in chemistry, biology, zoology. You can even be a math major, English. It really doesn't matter. You just need to have the prerequisites, and you can get a lot of those through some online courses. A lot of schools will offer them, especially like animal nutrition. And even your school may have, your current school or future school may have opportunities where you can get some of those science courses, even if you're not necessarily a science major. And let's see. So vet schools are looking for well-rounded students. So grades are definitely important, and some schools value them more than others, but it's not everything. You can have a 4.0 and not get accepted into veterinary school because you're not well-rounded, or you don't have experience hands-on with animals, or you're not the candidate they're looking for. So it's definitely not everything. I did not have a 4.0 GPA. And I had a strong GPA, but definitely lower than a lot of my friends that were applying as well. I had a very solid base of leadership and hands-on experience, which made me competitive in my application. So the AAVMC website, so that's the Association of American Veterinary Medical Colleges, that's going to be the best way to find out more information. So if you want to look up each individual school, what their prereqs are, you want to get just more information on all of that, that's going to be the best website to find info. Also, there are 33, so just some stats, there's 33 vet schools in the US, 5 in Canada, and 15 internationally. And they are all AVMA accredited of these ones. There may be a few outside of the AVMA accreditation internationally. But as you can see, vet school is extremely competitive. I did not get in my first try. I actually was waitlisted my first round of applications, and it definitely, was hard to kind of process that and hard to come to that realization that I wasn't going that year and I was going to have to reapply. But I want you all to know that vet school is extremely competitive. And a huge reason for that is because there are a fraction of number of vet schools in the US than there are any other health professional school. So don't get down on yourself if you are in that application process right now and you have to reapply. Okay. So again, another really important thing to make your application strong is getting experience working with animals in whatever capacity that means. So how I started my journey is that I decided when I was 4 years old that I wanted to be a vet. I was one of those kids that was like, yep, I'm going to be a vet one day. And that never changed. So I decided in high school, besides, having owned my own pets and taking care of them, that I needed to actually do something that involved me in the veterinary field to know if this is exactly what I wanted to do. So I did an occupational program with my high school. And basically what that was is like an after school class, and it was on animal science or I think it was on animal assisting. And so I learned kind of all the basics. I learned about vaccines. I learned about animal nutrition. I learned about different dog breeds, cat breeds, things like that. And that kind of gave me a good foundation of just learning like some medical terminology and learning a little bit more than just the basics of owning a pet. And then that program paired me with a local vet hospital where I did a 3-month internship. And that was when I was 16. And then they actually hired me on. So I worked at that small animal hospital for 9 years prior to going to vet school. And that definitely set me up for kind of the future and being able to know all aspects of veterinary medicine. I started off as a kennel attendant. So for anyone in high school, you definitely can reach out to vet clinics near you, see if you can even volunteer. Anyone in my area, even in Southern California, you can always get into contact with me. I may be able to help you out with that. But even just being able to get into a vet clinic and see what we do on a daily basis is really important. Then after that vet hospital, so again, started as a kennel attendant, I worked my way up. I did some reception work as well, which is equally as important because it really gave me a good foundation for having communication skills. And so much of my job is communicating with clients. So many people may think that, oh, I want to be a vet because I don't want to deal with people. I don't want to work on people, and I just don't want to deal with people at all. Although I'm glad that I don't work on people, I deal with a lot of clients. So I have to interact and be able to communicate well with a wide range of clients. And so it's definitely not the job that you can kind of hide from the public or anything like that. You have to be able to work with people easily and be able to communicate well. And then I also was eventually a technician, which helps me gain my experience with drawing blood and doing all of that technical things on animals. So you will learn that stuff in vet school, but it is really nice to have a foundation prior to vet school, because then you can you can focus on the medicine aspect. When you're in vet school, you can focus on that side instead of having to learn the technical skills as well. But you definitely still will learn that. And then vet schools are also looking for leadership roles. So they're looking for, so just like the pre-health shadowing group mentioned, leadership roles, volunteering, things like that. Stuff like this looks really good on your application. So you can definitely do this in high school, in undergrad, get into leadership roles. I did some leadership just in my community in high school, and then also through sports teams. And then in college or in undergrad, I was in my pre-veterinary club. I was a member of a livestock team. I did a lot of different things to like put me on as a board member, that kind of thing, to just build on my application. And then other requirements, letters of recommendation, of course. So for those of you in undergrad, definitely start thinking about who you can ask for those as far as professors go. And then the GRE is the standardized test that is required to get into vet school. I definitely hated this test. I did not do very well on it. I still got into vet school. That was not one of the things that held me back necessarily, but I just don't do very well on standardized tests. And then VMCAS, VMCAS, that is the portal to where you'd submit all of your veterinary applications. And that also, if you just type in that in Google, it'll give you a lot of information on their site, as well as things that I've talked about today. So again, touching on experience, I cannot recommend it enough. The biggest thing that I see with students that I get at my current hospital, so we do mentor a lot of students, high school and beyond, and even students in veterinary school. And one of the biggest downfalls, in my opinion, and doesn't mean that it's going to reflect negatively on how you are as a doctor in the future or anything like that. But what I find is that the students that have some hands-on experience really have a leg up. They're really able to understand the veterinary industry by the time then they get into veterinary school and then go off into practice. So as much as you can do to start early, I'd highly, highly suggest it. Another thing that I forgot to mention, in undergrad, I also did some research. We had like a milk lab at my school, so I did research there. And then I also worked a little bit on the farm. So we had an equine unit for horses. So I was on like the foal team and I did things there. And then we also had cows, pigs, sheep, and goats. And so I took care of some of those animals as well. And like I mentioned, I currently work at the Orange County Zoo. So I actually started as a volunteer there when I was in undergrad. I thought that I wanted to get into the exotics world. So I thought that was probably the best way that I could do that, is by seeing how I can get some hands-on experience with some exotics. And the Orange County Zoo actually has animals just native to the Southwestern U.S. So it's not going to be like a lot of, they don't have like elephants, giraffes, things like that. It's going to be a lot of mountain lions, bobcats, owls. And so I wanted to be able to get kind of the wildlife side of it as well, because those animals are native to this area. And so I volunteered there in undergrad and up until I went to vet school, basically. But eventually I got hired as a zookeeper there, which was awesome. And so now it's really exciting to be one of the vets there. And then I also worked at an animal shelter before vet school. So I did that actually the year that I got waitlisted. I wanted to get some additional experience. I wanted to be able to strengthen my application. And so I worked at an animal shelter as a technician and had a great time. And that got a lot of experience as well. And then when I was in vet school, another thing that you kind of want to prepare for is there are a lot of clubs, there are a lot of other opportunities that you can get in vet school, which are really important to take, especially if you do want to end up getting a residency. They also want to see things like that you have some leadership. But the clubs that I did in vet school actually helped me get some extra surgical experience and just extra hands-on experience, which was awesome. And so a little bit more about my school. So I went to WesternU and I chose this school. This was my top choice. I really wanted to go there because of the program. I had gone to a few preview days where I got to learn how everything was done at WesternU. So I can really only speak to WesternU really specifically. There are a lot of other great vet schools though out there, completely amazing. And so it just really depends on what curriculum is right for you. So we have two different types. Basically the traditional where you sit in lectures every day and you get notes and then you know exactly essentially what's on your test and you study for that. Still very difficult, even though you have those notes and everything. And then Western U does PBL or problem-based learning. So all of my studying essentially was done in groups. We didn't have any lectures. We had anatomy lab and we had PBL sessions where basically we would go through a case and break it down each step of the way. That's how we formulated our study guides. Essentially, that's how we formulated what was going to be on the test. So it was almost like a free for all. It wasn't, they didn't tell us, hey, you need this book and you need to do this. It was just, here's a case and you learn it. So it can seem really intimidating, but for those that like that kind of style where you're not in lectures, then it can be really easy to kind of flourish in that atmosphere. So if you guys have any other questions about like Western U specifically or problem-based learning, which a lot of other vet schools do now as well, definitely drop them in the chat and I can expand more on it. But so some of another reason that I chose to go to Western U is these are all pictures, or most of these are pictures from my 4th year of school. So basically your 4th year of veterinary school, no matter where you go, is your clinical year where you just get all the hands-on experience. You are not doing like the studying anymore like you were in the first couple of years and lectures and things like that. So Western, because there is no on-campus hospital that's like a really big hospital like most other veterinary schools, they actually contract out with hospitals all over the country and all over the world, basically, so that you can go and learn from anyone. So I decided my 4th year that I wanted to travel a lot. I wanted to get out there. So I went to South Africa. That's the picture in the middle. That's me with a hyena. And it was an amazing experience. So I was there for 5 weeks and I got to work at the zoo in South Africa, Johannesburg. And then I also got to work in some surrounding areas doing some wildlife. So it was great. And then some of my experiences also were working at an avian or bird specific hospital in LA. I also went to the East Coast and did some emergency work. I kind of traveled all over. It was really something that I was interested in. So that was one of the biggest perks for me on going to Western U versus another school. Okay, and then I'm going to talk to you about my typical day. So again, I said I'm going to use a lot of pictures because that's the best way for me to explain it. So the picture on the top in the center of that lion, so that was actually my first appointment ever as a vet. So the hospital I work for, again, like I said, does small animal and exotics. And we have a lot of clients that are either in like the movie industry and they own a private collection of exotic, like large exotic cats or exotic animals that they train for the movies. And so that was my first patient ever. That is Zuri. He is a 5-year-old African lion, and he was having seizures. So I went out and I had to place an IV catheter into him. You can kind of see the little IV catheter on his back leg, and there's a line of fluids running into him. And I went through pretty much 3 bottles of medication to try to get him to stop having seizures. He was about 600 pounds in that picture. And then also I see frogs, I see chameleons, dogs, You can see an owl there as some of the wildlife, a hamster, and a toucan. So basically every day I walk in and one of these species may walk through the door. A client may own one, or we get wildlife in from animal control that someone has reported, let's say an injured owl. So they go pick it up and bring it to us since we're the wildlife kind of center for our area. Some days I do surgery in the morning and then see appointments in the afternoon. That's the majority of my schedule. So I'll come in and I'll have lots of routine things, but I also have some different kind of procedures or exciting things I'll show you in some later slides on some cases that I've had. So basically, I come in and every day is different. I see a range of species. So that's a little bit different than, again, a traditional veterinarian that just does small animal medicine. But a lot of people are really content doing that because it is really challenging to have to know everything about every species. But that was just something that I was very passionate about and wanted to be able to do that. And then, oops. So another part of my typical day is when I'm at the zoo. So that is a little bit different than when I'm at the clinic. So similar day in that I still do exams or health checks on the animals, but that I actually go on site to the zoo and I will check on the owls. We have camels at, not at the Orange County Zoo, but one of the other zoos that we also work for. And another one, I have done tigers as well, lemurs, things like that. So basically my day at the zoo would be that we go in and see what animals are on the list of things that we need to check for the day, or check any animals that are having issues since the last time we were there. Sorry, my computer's acting up a little bit. So, okay, so I'll get into a little bit of case discussion. And so that'll really show you a little bit more about how my days go. So this is Moo, a little 4-month-old Syrian hamster. I have been unofficially known as the hamster queen at my work because I get in a lot of hamsters. I love them and kind of have a little way with them. I've, knock on wood, not been bit by many hamsters. So this little one came in because her owner reported that she dropped something and thought it dropped on the hamster. So we were concerned that she came in presenting for non-weight bearing lameness on the left rear leg. And what that means is she came in, she was limping, she was holding that leg up, she wasn't able to put any weight on it. So the first thing that I wanted to do was some diagnostics or some x-rays or radiographs. So that was going to be the best way to tell me, okay, what's going on with that leg? Is something broken, or is this just a soft tissue injury or whatnot? So just like you would, let's say, take an x-ray of your leg or your arm if you had an injury at your own doctor, I do the same thing. So there is that poor little hamster's leg. You can see it's broken. The pictures are the same. It's just I wanted you to be able to see exactly where the break was. So you can see that in the picture on the right. I've circled it. So that is of the tibia and fibula bones. So that's between your knee and your ankle. All of their little bones have the same names and everything that ours do. So because that break had just happened, it was in one spot, and it was very clean, the best thing to do was surgically correct it. So we have a couple of options. We're a little bit limited with hamsters because they're so teeny tiny. And so they will also chew off any kind of bandage that you put on their leg, or chew off sometimes, unfortunately, even their own leg if it's uncomfortable to them. And so it gets a little bit tricky, but because they're rodents, they have really big teeth and they love to chew. So what I ended up doing with this little hamster though, is I took her to surgery and I put a pin in her leg. So you can see that's her on the surgery table with her leg taped up so that I could access it. And that was before we cleaned and sterilized the surgical area. The picture on the right is the pin that I used. So I used a very, very tiny pin and I got that into the leg and fixed it. So I can report that that hamster, so I kept that pin in and I tried to bandage as much of the leg as I could. I kind of saw her weekly for rechecks, so I could see if she was chewing on anything, and she was pretty good. She left everything alone. And I was able to pull that pin after 6 weeks and everything was fully healed and she's doing amazing. Another case that I had recently was Blue, a 6-year-old parakeet. Blue is a female and does have a history of laying eggs, and she presented for a swollen abdomen. So her owner was concerned that she was breathing heavily and her abdomen was swollen, and he wasn't sure what to do. So as soon as I saw her, I could feel that she had an egg stuck. So this is something that I actually see really commonly in parakeets and a lot of other birds. They do lay eggs, the females, even if there's no male around. It doesn't matter, they'll still lay eggs. And so another cool thing with birds is they have lots of different special anatomy than a dog or a cat. So those are some things that you get to learn and really need to know if you do decide to practice with exotics. And so this little bird, I also took an x-ray. Again, the two x-rays are the same thing. I just circled where that egg is. So hopefully you guys can all see where the egg is on the picture on the left. You can see that outline of it. And in my hand there are two eggs. One of them was not her egg. Actually, the egg on the right is her egg. And the egg on the left is an egg that I had a couple months back. And so her egg was really, really big. No wonder she couldn't pass it. It's very subtle in the picture, but you can see that the egg on the left that's on the picture in my hand is a little bit smaller than the egg on the right, which was hers. So I actually had to sedate the bird and try to go in manually through their cloaca, which the cloaca is an opening where everything comes out of. Eggs, feces, urates, which is their urine portion. So everything comes out of there. I had to try to go in there manually with a lot of pain medication on board, and she was fully sedated. I almost thought I wasn't going to be able to get the egg out because it was just so big. And you can see that it really almost doesn't fit through that pelvic area. So I was eventually able to get it out and she did not need surgery. But if I had not been able to get it out, I would have had to go in through her abdomen and remove that egg. And then last case that is something that I also do commonly see in exotics is that I had this little Russian tortoise come in. You can see her there on the left picture. So she came in because she was constipated, and they will present in many different ways. Some of them you'll see they'll actually try to like push, or they'll make funny noises, is usually what the complaint is from the owner. And she hadn't been eating well. Well, I took an x-ray and saw that she had eggs in her, but they had been in her for a little while since she was not feeling well. And because she wasn't feeling well and wasn't laying those eggs, it was one of those decisions that was made that we needed to go in and remove those eggs because it was going to cause her more problems. So that's exactly what we did. You can see in the middle picture, that is me in surgery. That is one of my colleagues as well, just to have as an assistant, and those are her eggs. And the owner of this tortoise actually had a male with this female. So we are still actually incubating those eggs. So those eggs are fertile, and it can take up to a year for them to actually hatch. So we're still incubating those. So we'll see if we get little baby Russian tortoises. So just wanted to give you a rundown of my day. Again, I do see dogs and cats, and I see a lot of routine things with them. So things like ear infections, skin infections, but the kind of more unique part of my job is the exotics. And so wanted to just share a little bit more insight about the exotics. And so now I am definitely open for all of your questions.
Thank you so much for your amazing presentation. It was super cute with all the animals and very informative. Loved it. I know that I did. And as a question from a student, how does specialization work in the veterinary field?
Yeah, so with me, what I did is I actually did not get a specialty. So because of my experience prior to school, I had networked a little bit with my current boss. So because he was already the vet for the zoo that I work for, I knew him and I had met him before. And I knew I wanted to go essentially do what he does, see anything that can walk through the door, and then also work at the zoo. So I chose not to go into a specialty, which that specialty would be considered like zoo medicine. So there are specialties for basically everything. So you can be a surgeon, you can be an ophthalmologist, cardiologist, dermatologist, neurologist, every specialty that you can think of that there is for human medicine, there are for veterinary medicine. So and a lot of so in veterinary school, you actually learn all of those things as well. If you want to go on and specialize and just do ophthalmology, then you're just going to see eyeballs all day long, which is awesome if that's what you want to do. But I also still do see a fair amount of eye cases where I would just handle those on my own instead of referring them to an ophthalmologist. But there are definitely some situations where sometimes it's a little over my head, so I have to go ahead and refer them, and you make good relationships with the specialists in your area. But you do not have to specialize to be able to work with all of these cool animals. It's definitely not a requirement. As long as you get the experience that's needed in school, and as well as have good mentorship once you're out of school, then you can definitely still work with these species. So but if I had wanted to go into a specialty, then doing what I do would be most kind of correlated with zoo medicine. And there are also, I believe the AAVMC has a list of specialties as well. You can kind of search from all different kinds of specialties in vet med. So definitely a long list of possibilities.
Thank you so much. That was super informative. This one's a little bit more about you and your journey to being a vet. Could you speak on how many hours you shadowed a veterinarian and what was your GPA like competitively for other compared to other applicants?
Yeah. So my GPA was 3.5, and so I had a lot of hours. So like I said, I worked for 9 years at a veterinary hospital before I applied to vet school or before going to vet school. So had worked there maybe 7 years before applying. And that really gave me the majority of my hours. So I think that it depends on what the application process says. A lot of it will say you need at least 100 hours directly with a veterinarian. I think that changed, and it used to be 500 hours directly, but I probably had I would have to look back at my paperwork, but I probably had over thousands of hours just because I worked there for so long. So it was basically counting all of that. So all of the tech work and assisting work that I did throughout those 9 years, as well as my time at the Orange County Zoo, because I did work directly with the vet there, who's my boss now. But a lot of that, it also counts. So you can still use the hours that you have. Let's say you're a kennel assistant in high school, you can definitely use those hours, and you definitely just want to be able to also jump in and watch and see what the vet or the techs are doing when they're working on cases and start learning about that stuff. But you can definitely use your experience at an actual establishment. You just can't use your experience, let's say if you own pets or you just worked at like a pet store or that kind of thing.
Thank you so much. Kind of switching to a broader topic, is climate change a big topic in the vet world?
You know, it is, especially because I'm in the wildlife and zoo aspect. So in the wildlife aspect, it definitely is a big topic of discussion. And even though I do wildlife in this region, we still are seeing that their populations and ecosystems are, of course, being affected by climate change, just like ours are. And so I try to do as much as I can through my job to help protect and preserve a lot of these animals and their habitats and try to combat that. There are also a lot of opportunities for volunteers, either prior to vet school or during vet school, if you are interested in any wildlife work out of the country as well. So yeah, it definitely is something that is important and that we focus on in veterinary medicine. Maybe not as much as we should, but we definitely do.
Thank you.
Mhm.
Our next question is going to be about cases. So what was your most complicated case?
Ooh, that's a good one. Um, my most complicated case is or was so I'm gonna I'll give you kind of a broad example and then go to some specifics. So a lot of my most complicated cases are actually of dogs that have multiple diseases. So one of the diseases that's really difficult to treat in humans and animals is diabetes. And it is really complex to treat that in a dog or a cat, especially if they have any other underlying diseases as well. So if they have kidney issues, if they have hormonal issues or endocrine issues, anything that throws off their normal metabolic state, it can be really challenging to try to one, diagnose those patients, and two, keep them well managed. So a recent case that I had was a dog that I ended up sending to a specialist because he was diabetic. He came in also every week with something new and I was like, what's going on? And every week I found a different underlying disease that he had or something new that came up. So diabetes can also significantly complicate just a normal person's immune system, just your body in general. And so it goes the same for dogs and cats. And it is one of the most complex cases and just diseases in general that I treat.
Thank you so much. Next, if any students would like to make it a little bit more interactive and ask questions themselves, feel free to do the raise hand function and we'll go ahead and call on you. Gloria, if you want to go, you can go ahead and ask your question.
Yes, I hope this is not being too personal, but I know vet is not a job that you should do if you want money, but the more I learn about vet in the US, it just doesn't seem possible for me to like pursue other field other than hospital setting to pay back the enormous amount of debt you'll accumulate in vet school. So I'd love to know how you dealt with your debt and was there any other help you received from the school or some other scholarships? And I would also love to know if it's financially realistic to work in fields that doesn't pay as well as, say, like hospital settings.
Yeah, that is an amazing question because no one goes into the vet field to make $1 billion or anything like that. We all go into it because we love animals, but it is to a point where you have to be realistic about, can you have a future? Can you have a financially stable future? And so the kind of short answer of that is yes. So I am in a lot of debt from veterinary school. WesternU is a private school, so I'm about $400,000 in debt, which is an enormous number and kind of freaks me out sometimes, but I have a really great financial advisor that helps me with my student loans and helps me with just general finances. And he's so great that I don't even pay him a single cent because he does this as a living, but a lot of it is something that you don't have to actually pay for unless you start going into like investing in different specialty things that he does. So that was the biggest thing that I recommend, even at any point considering going into professional school. Definitely being able to have a financial advisor is important. So I live in a fairly wealthy area of Southern California. And so it was definitely a concern for me for, okay, how am I going to realistically continue to live in this area on my own? I did not have any financial support from family or anything like that. So I just had all of my student loans. How am I going to make a living and stay in this area and be able to have a life outside of work and be able to do this? And I got really lucky. I found the right position for me that allowed me to do kind of not just the traditional of working at a hospital alone, while also being able to make a decent amount to be able to live life and still travel and still have a savings and things like that. So when it comes to some of the other specialties, or not specialties, but just other kind of areas of vet med, you're right, Gloria. It can be really difficult to make a living wage. So if I wanted to be just a zoo veterinarian and not work at the small animal hospital as well, or do exotics, then my salary may be significantly less than what it is now. And that is something that you may have to think about. Is you can definitely work at, let's say if I were at like the San Diego Zoo, or I was at another like top zoo, then you can make close to what you would if you were at a small animal hospital. But if you're at a smaller zoo, or let's say you work on a farm, or you work with horses, or you just do other areas of the field, it is a very kind of true statement that you are not going to make, or may not make, as much as you do in the small animal field. But definitely some other areas are different. So the lab animal medicine field, or working as like a nutritionist, or working in the pharmaceutical industry, that kind of stuff, that can definitely bring your salary up. And another thing that I did starting off when I was a new graduate, sorry, I forgot to mention that I graduated in 2016 from WesternU. So I've been out now for 4 years, almost 5 years. And so when I first started, I also worked relief shifts. So I kind of put my name on a list of people that were looking for relief veterinarians, and I would pick up shifts here and there. So I was working a little bit too much when I first started, just to kind of make up the difference for that extra money. But I'm definitely happy to go more in depth on that if you want to shoot me a message too, or I know it's kind of really complicated. So I hope that answered your question a little bit, but there are definitely ways that you can have this career and be happy and still be financially stable.
Thank you.
Thank you so much. That really helped out. So Tahira, do you want to go ahead and ask your question?
Yeah, sure. So I have a question and a statement after. So hello, my name is Tahira. I'm a sophomore. I attend Towson University and I'm majoring in biology. So my question for you is, how do you suggest that we get involved and get veterinary experience during COVID? I know that's a difficult thing for everyone. And then just a statement, I'm going to make a group me just so that we can unite everyone in here, because I'm assuming everyone in here wants to be a veterinarian. So if y'all just want to click the link and join us so that we can chat and talk outside of the space. But thank you.
Totally. That's awesome. Yeah, so it is really hard to get experience during COVID. That's obviously what you guys are all here too, is to kind of learn more about this. So I definitely do offer some shadowing, mentoring, that kind of thing. If you want to kind of see what I do throughout my day, if you want to sit and talk about cases and things like that. I also find that the best thing to do is still just reach out to places around you. The worst thing that they're going to do is say no. which is really unfortunate. But a lot of hospitals are still taking volunteers. They're still taking people in some capacity, because a lot of places also thrive on having volunteers. And so it has been really detrimental for some of the places that I do consulting for, like the local animal shelters, because they thrive on just having that volunteer support, and they don't have anyone right now. So a lot of places are definitely still taking volunteers, still allowing students to shadow. And another great thing is, if you can arrange anything through your current school that says, like, hey, I need to get a certain amount of hours, even if they can do something for you, a lot of hospitals will say, oh yeah, we can take you, because it's like for school, it's something a little bit more official. But any of you that are looking, if you're in a specific area and you're having a hard time finding places, definitely reach out to me. I have a lot of friends all over the country, and I may know another vet near you, so I can definitely connect you with someone.
Thank you so much.
Of course.
Thank you. That is highly appreciated, I'm sure, by everybody here. Next, Mariana, if you'd like to ask your question, you can go ahead and go.
Hi, so my name is Ariana. I'm very young. I'm actually a sophomore in high school, but I'm very dedicated to wanting to become a veterinarian and actually specializing in surgery. So I had a question, what is the best way for me to get experience now? Because it's very difficult because of my age. I have applied to many vet hospitals. I'm not applied. I have sent emails to vet hospitals to ask if they were interested in having a high schooler shadow, but I really am not sure of any other ways. Do you have any tips on that?
Yeah, so a lot of, like, just how I volunteered at the zoo when I was an undergrad, they also took like high school volunteers as well. So it's not just at a hospital. You can also reach out to pretty much anything in the animal industry, or anywhere in the animal industry. So let's say it's the animal shelter, let's say it's a zoo, or even some of like the small breed specific rescue organizations. So like dog rescues or cat rescues, they also have veterinary teams. They're not always on site, but they will go to, or the vet will come to them. And a lot of those places need volunteers as well. And it's a great way to start learning about like the husbandry of all animals. So that would probably be one route I would go to, is try to look into some rescues in the area, but keep reaching out to those hospitals. Just keep sending emails, and just check and see if your high school may have any kind of occupational program. I did the Coastline ROP. I think it's a California specific thing, but other states may have something like that as well, so that they can get you connected. And then also, if you can, even start applying to jobs, maybe once you're 16, or depending on your area, if you need a work permit through school, that kind of thing. That's another way to go. Even if it's just a part-time thing, even if it's just 1 to 2 days a week, it'll still get you that experience you need.
Thank you so much.
Of course.
Okay, Gloria, you can go ahead and ask your questions. After Gloria speaks, Barbara will be asking more questions from the chat, and we'll just keep going back and forth like that, okay?
So I'm Korean, and I was thinking of maybe going back to Korea for vet school just to, save money. But I was wondering if it's realistic to come back from overseas school back to the States to work. So if you have any colleagues who finished their schooling in other countries and came to the States.
Yeah, it's totally reasonable to do that. Absolutely. I've had colleagues do that, and I've also had colleagues kind of the reverse, where they ended up going out of the country after vet school here. So it's definitely reasonable. The biggest kind of it's not really a hurdle. The biggest change or difference with that is that you'll have to take an additional test to then have your license be able to be to work in the US, basically. So you'll be licensed in Korea, and then you'll also be licensed in the US. But then you'll have to pick like like a specific state to practice in, and there's another test for that. So after you graduate vet school, you take the NAVLE, which is basically your national boards. So anywhere all across the country, that's the test you take. And then you take state boards. So whatever state you're in has their own specifications for things. Some are just, you just pay for the license. Some you actually have to take an additional test. And then the only difference with transferring back into the US from an international school is just kind of another test that allows you to practice in the US. So I don't think that it would be a big deal at all. I think you'll get still a great experience. And yes, you're right. It'll definitely be less financially on you, which is one of the biggest kind of problems with veterinary medicine, is just how expensive vet school is. But I still don't want that to stop anyone. If you are really passionate about this, there are definitely ways that you can be smart and you can still thrive after, even with a high student loan debt.
Thank you.
Mm-hmm.
Thank you so much. Kind of shifting back to talking more about your hands-on work, how do you manage shifting your thought process from treating one species to another?
Yeah, definitely something that you get used to. In the beginning, it was more of a challenge than it is now, but just as I have used a lot of examples that kind of cross over into human medicine, I do that in my daily work. So if it's something that I do for a dog or a cat, it's most likely something that I can still do for a hamster or a bird or a snake. And I know it seems weird, but if I have a dog that comes in not eating, the reasons that could be are the same reasons that it could be for a snake that comes in not eating. So I would do the same things diagnostically. I may choose to do blood work or x-rays on both of those types of animals. And so that's the biggest advice that I have, is to treat it. You can't always treat it exactly like a dog because they are a different type of animal, but you want to still have that same train of thought. You want to still say, well, if it was a dog, I would do this. Okay, great. Then you can absolutely still do that on a bird or a snake. And once you're in practice, then you kind of start to learn the little tips and tricks when it comes to each exotic species.
Thank you. Speaking of tips and tricks, do you have any to remember all the different pathologies among a huge variety of patients?
I definitely did in vet school. I had a lot of like mnemonic devices. Otherwise, I would not have been able to remember like half the things. And some of them are not really appropriate to share in this setting, but because they're just funny. But now I still research things. I still look back to my notes that I have from vet school. I still have a lot of resources that I used in vet school. So a lot of it is just up in my head, and I know, and I don't have to remember it. I just know it. But there are a lot of things that come up that I'm like, wow, that's unique. That let me go back to my textbooks, or let me go back to my notes and see if there's anything else. There's also a really great, which you guys may be able to have some kind of access to. It's called VIN, or the Veterinary Information Network. And it's actually kind of like it's for veterinarians, but it's for a lot of other types of professionals in the field and students as well. Check it out and see if it's possible that you can have any kind of like free trial of it or log in now. Even if you're not in vet school, you might be able to. That's another way to get some like online learning about species as well. And so again, it's called VIN, or Veterinary Information Network. And so that is something I'll look at almost every day. It's basically a big platform of vets all over the world, and we're constantly posting cases or referring back to like a drug formulary or something. So it's one of the biggest things that helps me if I forget something, or if I just want to refer back to something. So most of the things I remember, but that's typically what I do if I need refreshers.
Thank you so much for sharing that resource with us. We talked a little bit about specialties earlier, and another question is surgery in as a veterinarian considered a specialty?
Yes, absolutely it is. So one of my colleagues that was in my class, he decided to do a surgery residency. So basically what that entails as far as his journey. So he did the 4 years of vet school. After vet school, he did a 1-year internship doing just like a general rotating internship. And what that means is he worked at a hospital and he didn't specialize in a specific thing yet. He kind of just worked in every position in the hospital through all the departments. And it's usually at like a big specialty referral hospital or an emergency clinic type setting. So he did that. Then he did 1 year after that as a surgery intern. So that was at a specific surgery hospital or surgical site where he was just an intern in the surgery department. And now he's in his 3rd year of his surgery residency. So an additional 5 years past vet school, basically. And then once he graduates, he can work anywhere. He can do his own like mobile practice if he wants. He could travel around and do surgeries at other hospitals, or he can work at a specialty hospital that does surgery that people will go to him. And then just so you guys know, in regards to like the type of surgery that I do versus the type of surgery a surgeon would do, is that I don't do any orthopedic procedures, with the exception that you saw that hamster. And that is because most surgeons are small animal or large animal surgeons. So they're going to work on large animals like horses, or they're going to work on small animals like dogs and cats. Most surgeons do not do the specialized kind of animals or the exotic animals. So I can do something like pin the leg of a hamster, but I can't do something like pin the leg of a dog, actually. So I know it seems funny, but that's when I refer to my colleagues that will do surgery like that. I do routine surgery like spaying and neutering on all species, and I do surgeries like taking a mass off, like a mass removal, a lot of dentals, lots of dentistry. So I do a lot of similar surgeries that surgeons do, but I do the more routine things. When it comes to, okay, this animal needs a part of his liver removed because there's a tumor, then I'm going to send that to a surgeon. Or if they need like a chest surgery or surgery on their heart, definitely is going to a surgeon, not something that you're going to necessarily do as a general practitioner. But one awesome thing, or one thing I love about being a general practitioner, is that I get to do those things if I want to, or if, let's say, I have a client that's financially constrained and can't go to a surgeon, then I may be able to do it.
Thank you so much. So our next question's sort of sad. It's sorry. It's how do you deal with euthanizing and how emotional it is? And is it hard to get back into work after you just euthanized an animal?
Yeah, so great question. It is never something that's easy or happy or anything like that. And I shouldn't say it's never happy. I should say that when it does feel like a very big privilege that I get to do that for animals that are suffering and for their owners that watch their animals suffering, and that I get to relieve their pain. So it is a really big privilege, but it is never easy. It is never something that makes me necessarily happy to do, but I understand those moments that it really is necessary. So I tend to, and most hospitals tend to schedule euthanasias towards the end of the day, if possible. So that way you don't actually have to just then jump straight back into work. But there is also a certain level of where you have to disconnect a little bit. Before, when I was in vet school, I thought that I would cry during every euthanasia. Like, I was really nervous because I thought I was just going to get really emotional and not be able to like do my job properly, because I was going to cry, because I would see the clients crying and I would have to do this to the pet. But what I realized is, one, it's completely okay to cry. It's completely okay to show your emotion during something like that. And two, I actually, because I was more nervous, wanting to make the experience very peaceful for the pet and very just peaceful for the owner as well, my emotions kind of got stopped a little bit. I was just very focused on the experience and trying to calmly explain what I was doing and the process to the owner. So many people don't actually get as emotional as you think you might. And then there is a certain level where you'll have to disconnect, where you have to maybe take 5 minutes and cry, or take 5 minutes and feel that sadness, and then be like, okay, I have to pick myself back up and go on to the next case. So there are definitely days where I've had multiple euthanasias. Sometimes I've even had to do 5 in one day, and it does really take a toll. By the end of the day, I feel exhausted. I feel like I have nothing left to give to anyone. And so those are definitely days that, are not anything I look forward to, but I'm able to realize, hey, those animals were suffering. That animal had this disease that couldn't get better. What I did was a positive thing. And yes, it is sad, but I did the right thing by the pet. And so you also want to make sure that you have a good relationship with your boss or whoever you work with, because if you've done a few euthanasias and you're just like, I'm at my limit, I can't go through any more like emotional exhaustion, then you shouldn't have to. So definitely hard part of the job, definitely the least glamorous part of the job, but can also be very rewarding just to be able to do that for pets and their owners.
Thank you so much for being open and honest and sharing that with us. It's very greatly appreciated. Our next question is kind of shifting gears. We had talked a little bit about treating different species before, and a student's asking, which species do you find the most difficult to treat?
Ooh, good question. So kind of I have a couple of examples. So hamsters, I actually find to be one of the most difficult things to treat because we're so limited. They're so teeny tiny. So even though I don't find it that hard to treat them myself, I think just overall it's really hard because they're so tiny. But if I had to pick another species, I would say that birds are probably the most difficult to treat. Their anatomy, their physiology is very different than a lot of other species. And one thing that is just really silly about birds is they get so stressed out to the point of that you can accidentally cause them to die if you do too much too soon with their exam. And I know that's one of the biggest things that people say, or like my colleagues that are like, I don't want to work with birds ever, that all they do is die. And they're not wrong. They're very fragile species. So I love working with them, and I know exactly where that limit is. I know exactly how to explain to an owner that if I try to do this for your bird, it's not going to go well. So you learn those things over time, but they are actually a really challenging species to work with because their drug doses are different. Their medications that you use in them are different or can be different. Lots of kind of special things with them that are different about a lot of other exotics.
Wow, such a heavy topic. Switching gears, can you speak about how did you heavily rely on loans or financial aid, or were you able to have a good variety of grant support?
I relied almost 100% on loans. So all federal loans, like a grad plus loan, basically is the loan for vet school. That was about $75,000 a year for 4 years. And so that included my tuition, but also my living expenses, because I personally could not work during veterinary school. The hours are extremely long. It's very taxing. It's not something that I would ever really recommend to someone to work during vet school. I had maybe only a few colleagues or a few classmates that that worked because they would work on the weekends or maybe overnights at an emergency hospital. But overall, most students do not work during vet school. And then in regards to grants and things like that, there really are not, at least for my school, there weren't really any grant opportunities, and there were a few scholarship opportunities. So depending on if like you were in a certain club or if you applied to just certain scholarships, you did get some support. But whereas in undergrad, it's getting like a several $1,000s is good in undergrad because it can actually make a dent in your potential tuition. In vet school, getting a scholarship of $500 or $1,000 put towards my tuition did not make obviously a big enough dent as I'd hoped or anything like that, because most of those went directly towards my loans, not like personal money or anything like that. So you do really have to rely on student loans, unfortunately, unless you have the financial means to pay straight out for tuition. But if you are close enough to your vet school to a vet school that you want to live at home or that kind of thing, then you can definitely save on hopefully rent, tuition, living expenses, things like that. And you kind of don't have much of an outside social life during vet school, so you'll definitely save money on that kind of thing.
Thank you. With all of these kind of heavier topics that we've been talking about, how do you maintain your mental health after work?
I love this question. Mental health is really, really big topic in just the healthcare professionals or healthcare profession industry in general. So a few kind of recommendations is when I first started, I worked whatever schedule I got. I worked a lot. I worked relief shifts. I tried to learn as much as I could and get as much on the job training. And I started to burn out my first year. I started to feel like, what am I doing? I wanted to do this profession since I was 4 years old, and I love what I do, but I felt so emotionally and physically and mentally drained. And I knew it was not something that I could sustain a long career. So, and I wasn't taking care of myself. I wasn't exercising regularly. I wasn't eating healthy. As very rewarding and requires a lot of your time, you have to make sure that you take care of yourself, because you can't be a good doctor for your patients if you can't take care of yourself. So I quickly realized that I needed to change things up. So for me, I was able to talk to my boss to do a schedule change because I was working. It felt like I was working close to 60 hours, even though, that's like way over a normal full-time job. I switched to working basically 3 to 4 days a week. I was still full-time. I didn't have like a cut in pay. I had days off in a row so that I could really focus on relaxing on those days. I actually also got a fitness and nutrition coach. So I work with that person currently so that I can get on a good schedule fitness wise and have like set meal plans and things like that, or meal preps each week. So I also do meditation. Pre-COVID, when Disneyland was open, since I live very close to Disneyland, I would go there as like a de-stressor when I had a pass and could just like go after work and maybe eat dinner or something there. So you definitely do need to find some outside hobbies, but you have to also really be an advocate for yourself. There's a little bit of, it seems like a mentality from maybe the older generation of veterinarians that kind of worked their butt off and that were, didn't have the student loans that we do, but they were able to work a lot and buy a home at the same time and support their families. And it just isn't quite like that anymore. But there's a little bit of a mentality of, well, I had to do it, so you do too. But I personally am trying to change that aspect of the industry. We have one of like the highest suicide rates, unfortunately, in the veterinary industry. It's something that should definitely be talked about. More and more people are realizing that it is something that we need to focus on. We need to appreciate our veterinarians, our technical staff. We need to have better schedules. We need to have better pay. We need to have a lot of things. So I want everyone that wants to go to vet school once they graduate, remember that you really need to advocate for yourself. If you have certain needs, then you need to let your boss know that you won't be overworked. You're going to take your lunch break because you deserve that. And that all just plays a role into your mental health.
Thank you so much for all of your advice today and your amazing presentation. It has been greatly appreciated by all of us, and your honesty and just your openness with the conversation was amazing. As we wrap this up, do you have any final advice that you can give to the students here today?
Yeah, a couple. One thing I can think of is when you do get the experience in the clinic, let's say you're in high school still, or even in undergrad, or even when you get to vet school and you're getting experience at different places, don't be afraid to jump in. Don't be afraid. There are no wrong answers. Don't be afraid to just say what you're thinking, to ask questions, to really get in there to make your experience great. And also, anyone that has any questions, otherwise, again, please feel free to reach out. I am always perfectly happy to be open and honest. I don't want to sugarcoat anything. I want you guys to know the real truth of veterinary medicine, because I want you guys to have a successful career if this is what you want to do. So thank you again, everyone, for attending, and thank you guys for hosting this. It's awesome.
Thank you, and it was such an honor to have you here with us today. For all of my students, please listen up. I have some great information for you. Stick around to figure out how to take the post-shadowing assessment to get your certificate for joining us today. This is just a couple questions to think about as you will be applying to various programs in the future. You want to take some time and reflect after each of these sessions. If any takeaways that you had from today, what really resonated with you, and what motivated you to join us today, because that is such a big reason. Why are you going into the health field, and really carry that close with you as you continue your journey. So this isn't anything that you have to submit, but if you are looking to get published, definitely you are welcome to submit this. You can visit our website, prehealthshadowing.com/blog submissions, and submit a reflection. It will get sent to our editor-in-chief, and you may get some revisions back. And so this is a wonderful opportunity for you to not only grow on your academic writing, but also to have something to show for it. You can put the link to Pre-Health Shadowing and say, look at this website, and I am featured on it. And so that's a great opportunity if you are interested. If you are interested in gaining a mentor, like I said at the beginning of this presentation, we are having a mentorship networking weekend. You can gain an invitation by downloading our materials from our Google Drive, registering as a volunteer on our website, posting this on your social media, and turning it in when it is done. That is all it is. You have until the end of January to get this turned in. Once you do that, you will reserve your spot to our event and gain an invitation. Be sure to tag us in your posts at Pre-Health Shadowing and use the hashtag Pre-Health Shadowing. You have the opportunity to get reposted on TikTok, Instagram, Facebook, and Twitter. This is a link to join our fundraising team. So I would really appreciate it if you guys are looking for really easy volunteering hours. This is one way to go. By sharing our fundraising link, you can actually gain virtual volunteering hours. So please ask, any family who supports your education, any friends who want to see you thrive, professors that you've gone to their office hours for and they want to see you go to the next level. And so please help us raise money to keep this program alive. You guys are the reason we're doing this, and you guys are the only things that can keep us alive right now. We are actively reaching out to receive grants and sponsorships and donations, and so we really appreciate anything you guys can donate today. If you are interested in gaining some leadership experience, we have a wonderful opportunity for you all. This is 100% remote. You get the opportunity to not only meet with like-minded students, but to connect with professionals in terms of outreach, collaborations, and many more. You can lead your own projects and manage a team of students. So if you're interested, you can apply on our website, prehealthshadowing.com/join our team. We understand that you guys are all pre-health students, and time is not something you have floating around. So if you are too busy right now, we totally get it. There are volunteer opportunities that are super duper flexible. You get to work on your own schedule for as many or as few hours as you can. You can sign up on our website, prehealthshadowing.com/volunteer. This is a really wonderful opportunity. If you are, super busy throughout the entire day, and maybe you stay up until like, I don't know, like 2, 3 in the morning, and that's the only time you have extra when you're just scrolling around on TikTok. You could just send out some professional nominations, boom, 1 hour of, volunteering, easy. So help us out, get involved, and we can go far. We do have some upcoming sessions on January 14th. We have a double header. So check us out for that. We can sign up on our website, prehealthshadowing.com/sessions. We actually have lots of speakers booked in the upcoming few months. We are currently booked until April. So that's super great for you guys because you can plan in advance for this coming term, whether you're in semesters or quarters. Put it into your schedule, see when you're available, attend the live session if you can. But if you can't, no worries, because pre-health shadowing is working to make these opportunities flexible. Pre-health students, like I said, we don't have, time is of the essence. We're always doing something, whether it be classes, extracurriculars, just trying to have a life during this global pandemic when we are all inside. And so making sure that you guys are, using your time wisely, prepare and execute. All right. Now what you have been waiting for, how to get your certificate that verifies your virtual shadowing hours today. You will go to our website, prehealthshadowing.com, and find our guest speaker for today. Once you go ahead, click Take This Course. You will have 30 minutes and 2 tries to get over a 70%. Once you get a 70%, even if you think you can do better, you got the certificate. It's not going to show up whether you got a C or an A or anything like that. Take it, you passed it, get the certificate. Because if you decide to take it again, and for some reason you are unable to finish or unable to pass, you will no longer be eligible to receive your certificate. So once you get your certificate, be sure to click Finish Course and download it immediately. You can also find it at all times in your profile under the Certificates tab. If you guys have any questions or experience any difficulties, feel free to reach out to us at info@prehealthshadowing.com. Thank you all for joining me today, and I hope to see you at our future sessions. I invite you to disconnect from the call. Thank you, everybody.
Thank you.
And thank you so much.